Communication difficulties can occur as a result of a brain injury. For example, when damage to the brain affects the language system in the brain, we call that aphasia. So a person with aphasia may have difficulties understanding what's said to them. They may have difficulties finding the words and using sentences to express themselves. They might have difficulty reading that they didn't have before the brain injury, and they might have difficulties with writing and spelling. So not everyone with aphasia will have the same profile. So for example, some people will have difficulty understanding what's said to them, whereas other people will understand quite well. Some people might find that they're not able to read as well as they used to do, whereas other people might find that their reading is more intact. It all depends on the location and the extent of the brain injury. Most people with aphasia will have word finding difficulties. So for example, if we're trying to think of a cup, usually we've got access to lots and lots of words that we could use and lots of sounds. And we sort through that very quickly. We work out which sounds we're going to need and we put them in the right order, and then we come out with the word and we say cup. And it's very easy for us. When people have aphasia, that process becomes much less efficient. So what that means is they might be thinking of the word cup, but instead of saying the word cup, the brain picks the word glass, which is a related word, but it's not the one that they wanted. Or the brain might access a word that isn't related. So for example, the word tyre might come out. If the sounds get a bit mixed up on the way down, then you might find that somebody, instead of saying the word cup, might say the word cut. If those sounds get really mixed up on the way out, then it might be that the person says a word that doesn't really mean anything. So they might be thinking of the word cup, but instead they say a word like scacharam. A lot of people with aphasia will talk about having a tip of the tongue experience, and you and I have probably experienced that when we thinking of a word, and we're thinking it's on the tip of my tongue, but you can't quite think of it. That might happen to us just once in a while, but for people with aphasia, that happens a lot when they're trying to say what they want to say, and for them, you can imagine it's very frustrating. When a person has aphasia, there are things we can do to support communication and conversation. So for example, if someone has difficulty understanding what's said to them, we can simplify what we say without making it childish, but just reduce the content. We often say a lot of words when actually fewer will do. We could use keywords and we can emphasise those keywords so that the person can pick up on them and give the person plenty of time to process what you're saying. If a person has word finding difficulties, it might be that instead of asking a very open question, for example, what do you want to drink, which means they've got to think and access the words, you might be able to ask them a closed question, which is a question that needs a yes or a no answer. So you might be able to say, do you want tea? No. Do you want coffee? Yes. And then you get to the answer much more easily. It might be that if the person with aphasia has two choices, then they can pick one of them a little bit more easily. So, do you want tea or coffee? And because they've heard those two words, they can then say which one they want. They might also make use of communication charts. For example, they might point to pictures or words to try and help them say what they want to say, or to try and help give you an idea of the topic that they want to talk about. Now, not all strategies are helpful for everybody. So some people might find that if you write down a couple of words, that helps. Some people will find that doesn't help at all and actually might end up being a little bit more frustrating for them. So the most important thing I would say is don't be discouraged from having conversations with people who have aphasia. Get to know them, because the more you get to know the person, the more you get to know what helps them and what doesn't help them. A lot of people with aphasia will talk about feeling isolated because they can't have conversations in quite the same way as they used to do. So it's really helpful if people will go and make the effort to have conversations, because it can really reduce that feeling of isolation. So dysarthria is the name that we give to a speech impairment that occurs as a result of damage to the muscles that we use for speaking. So for example, the lips and the tongue. And the damage to the brain might affect the way that the muscles move. So the muscles might be weaker, they might be uncoordinated, or the movement is faster or slower than it would be normally. So for example, if someone had very weak muscles, it might be that their speech sounds quite slurred and that it's quite difficult to understand. There's no particular damage to the language system in dysarthria, so the person can think of the words that they want, but when they're articulating, it's more difficult to understand them. When a person has dysarthria, I think it's important for us as the listener to give the person who's speaking as much opportunity as possible to be understood. So we've really got to focus on the person who's speaking so that we can try and understand what they're trying to say to us. So we want to be sitting face to face to the person. We want to be able to see their face so we can see their lips moving, so we can see their facial expressions. We want to make sure there isn't a lot of noise so that we can really focus on them and listen to what they're saying, make sure a place is well lit. A person with dysarthria might use other ways besides speaking to communicate. So they might use gesture, they might be pointing, they might be writing some words down, pointing to pictures, or maybe using an alphabet chart. So we need to make sure that we're really focused on what they're doing, and also that if they do use those types of strategies, that they have access to all of those at that particular point in time. When a person has a cognitive communication difficulty, the person's communication is affected by an underlying problem with thinking skills or cognition. So for example, if they have difficulties with their attention or concentration, or if they have memory difficulties. And these problems can affect their ability to have a conversation in the same way that they might have done before the brain injury. So for example, if someone has difficulty maintaining their attention, it might be that in conversations they find it hard to listen for very long. It might be they get easily distracted. It might be that they wander off topic. And in those sorts of situations, what we need to do is reduce the amount of distractions that there are around, make sure that we're focusing on the person, and if they're going off topic, we can just gently bring them back to topic. We were talking about the garden. So thinking about a person with memory difficulties, we have to think about how often we rely on memory when we're having a conversation. So for example, I might say to you, what did you do last weekend? Or what did you have for lunch? And if a person can't remember, then it's very difficult to continue that conversation because you're relying on them to have the memory of something. It might be that someone with memory difficulties will repeat themselves quite a lot. They might have difficulty recalling conversations that you've had before. They might find it difficult to initiate conversation because they don't have the memories to base it upon. In those sorts of situations, one of the best ideas is to have conversations within a current situation, so something that's happening right now. So you might be looking at a magazine together, or you might be looking at a newspaper or playing a game. And you can have conversations based on that. You might be having a walk around the garden, and you can have a conversation based on that. So it's within the context of what's happening. You can ask the person their opinions, you can ask them about their feelings, and they can make choices. We have to remember that conversation doesn't have to be lengthy. If you give people opportunities to make choices and to give their opinions, then it's very valuable that they're able to do that. And we need to make sure that people are able to use the communication that they do have. It's very important for somebody's well-being and their quality of life.